While it's hard to pin down how accurate medical TV shows are at depicting healthcare, most studies show that Hollywood often exaggerates when it comes to factors like mistakes and death rates. But at the end of the day, is it important for a show to be so precise when the end goal is simply to entertain? Dr. Sylvia Owusu-Ansah says that while many don't make the effort, she believes they should.
I feel that things should be, if they can be medically accurate, they can be. But what I've been told by numerous folks who work within Hollywood was like, that's not our goal, Sylvia. Our goal is not necessarily for people like you, because for a long time, a lot of us healthcare professionals, we don't watch medical dramas because it's just too out there for us to even comprehend. And it's almost like, in some ways, for us, like a joke on what we do.
Owusu-Ansah is an associate professor of pediatrics and emergency medicine at the University of Pittsburgh School of Medicine and the EMS medical director at UPMC Children's Hospital of Pittsburgh. She thinks that media has a huge opportunity to provide more to the public than just an escape. For shows that center around medicine, the added benefit could be creating a better connection between patients and doctors.
I could talk as a medical expert till I'm blue in the face and maybe convince 2 or 3 people. But the beauty of media and what all of you do is you touch millions of people all at once. There are so many anecdotal stories of people finding out that they had cancer because they recognized the symptoms in a character on a TV show, or kids being able to perform CPR on a family member because they watched Grey's Anatomy or they watched The Good Doctor, or there's tons and tons and tons and tons of anecdotal stories on how impactful media is on our lives, even if it is a soap opera medical drama.
In order to get the most accurate information, many shows go straight to the source and hire medical professionals to pull from their real-life experiences. When producers for the new hit medical drama The Pitt began sourcing for their show, they went straight to Hollywood Health and Society. This program is part of the University of Southern California, and it provides the entertainment industry expert sources for storylines on health, safety, and security. They asked Owusu-Ansah to provide personal insights into the demographics and health disparities in emergency care in Pittsburgh, as well as the various conditions she's constantly faced with. One real-life concern that made it into the show's storyline was the influx of kids coming into the ER who've ingested weed gummies.
It's a really concerning trend that we're seeing in the pediatric emergency department of children ingesting THC, coming in almost comatose. It lowers the risk for seizures. They come in with seizures, and we do this $1 million workup only to find in the urine jug screen that they took some THCs. And then you find out that it was left in somebody's purse, or, it was just left out. And we see that a lot.
Owusu-Ansah was able to sit down with some of the show's writers and advocate for the history of emergency medicine to be included in the show. To her, you can't talk about healthcare in Pittsburgh without acknowledging the Freedom House ambulance service.
Freedom House Ambulance is the beginning of EMS as we know it. It started here in Pittsburgh in the Hill District, initially off of 25 Black men, later women, by the visionary Dr. Peter Safar, who was known as the father of CPR. He perfected CPR to what we know it to be today and was the first chief of anesthesia at the University of Pittsburgh School of Medicine, combined with Mr. Phil Halen, who led the Falk Foundation, which raised grant money, and Mr. James McCoy, who was a strong activist in the Hill District and had what was called the Freedom House Company that would bring like fresh fruits and vegetables to the people of the Hill District.
It was this up-close and personal insight that opened their eyes to the significant health disparities this underserved population faced.
In the mid to late 1960s, if you were sick, you called pretty much the police. You were put in the back of a paddy wagon and or even hearse, and there was no medical care on the way to the hospital. And at the time, David Lawrence, I think former Pennsylvania governor, then a mayor, had a heart attack. And Dr. Peter Safar was one of the doctors that took care of him, and he died. And I think that bothered Dr. Safar that something couldn't have been done in the interim.
And so he co-founded the Freedom House Ambulance Service in 1967.
These were the first ever paramedics on our soil. They put breathing tubes down, meaning they intubated patients in the field. That was the first time ever. They did EKGs. They did Narcan before Narcan was a thing. They drew up Narcan and gave Narcan for overdoses.
The writers agreed that they couldn't leave out such a pivotal moment. In the show, one of the patients turns out to be a former medic for the Freedom House Ambulance Service, allowing the character to educate millions of viewers on a historical moment in American healthcare. Fans of the medical drama will also see Owusu-Ansah's influence during an episode about sickle cell disease.
I was able to share my story about an interaction with a patient who had sickle cell disease, who was in a sickle cell pain crisis. and talk about the health disparities in pain management with people with sickle cell disease and some of the frustrations that lie therein.
Owusu-Ansah thinks we need more education around pain management, especially concerning the sickle cell community. Some patients are denied the necessary pain medication because physicians will mistake them for habitual drug seekers.
When you have a sickled cell, they're a little bit more sticky in consistency. They look like a sickle and they get stuck. They kind of pile up on top of each other, almost like having a traffic jam. It's like having a traffic jam in your bones of blood vessels, and that hurts. And we know that providing the best type of pain management for sickle cell patients helps them to live longer, better lives, helps them to be able to adapt on a day-to-day basis.
In her own experience, Owusu-Ansah has noticed that she only sees many of these patients when the pain is too intense to manage on their own.
By the time they come to the emergency department, it is a crisis. There's a reason why it's called the sickle cell crisis or pain crisis. They are in a crisis. They are at wit's end. They have tried everything. They have done everything that they can in the majority of situations. And it's a call for help. Any one of us is in the healthcare field who have worked with either sickle cell patients or bone cancer patients recognize that having bone pain is one of the worst type of pains that ever exist. And I think they did a good job on the episode describing it's like having shards of glass shooting through your vessels and it comes out of nowhere and you have no control over it. It affects your everyday life to have this bone pain, and it could be in your arms, it could be in your legs, it could be in your back, it could be anywhere. And so I think it's important to understand for patients who are in pain, that pain medication is not only okay for them, but required for them to live.
It's messages like this one that has medical professionals speaking out about how excited they are for a TV show to finally portray healthcare accurately. Owusu-Ansah says that even the smaller storylines are giving viewers so much context and insight into the true lives of healthcare workers. Not only does this accuracy come from outside experts, but one of the show's producers, Dr. Joe Sachs, is still an active emergency medicine doctor.
He is still practicing and writing this stuff. So when you talk about accuracy, he's living it. He lived COVID. He's living all the things. They have emergency medicine physicians on set during the production. All the actors had a boot camp. So the actors had to learn how to place IVs, intubate, not just make pretend, but actually learn how to do the procedures. They have broken the ceiling on this, honestly.
She hopes it sets the standard for more shows to follow suit and make medical accuracy a priority. You can find more information about Dr. Sylvia Owusu-Ansah and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.